So another question, a 25-year-old female, 25-year-old female. So this is a description. Let's say touch, man or male. This is a male and this is female. This is symbolic presentation. So a 25-year-old male comes with a chief complaint of sudden onset confusion. Sudden onset confusion that started 40 minutes ago. Started 40 minutes ago. And he also complains pain in his arms and legs, no previous medical history or drug history, does not smoke and drink alcohol occasionally. On vital signs, his vital signs all are in a normal range, and the lab was done and it was unremarkable. And on the physical examination, he was disoriented. That means he was disoriented to time, he was disoriented to place, he was disoriented to person. He is disoriented or confused, and he is unable to answer questions or follow commands. Okay, he is confused. And he has generalized pallor. Okay, his body, all of his skins appear pale, or has generalized pallor, and he also has multiple abrasions noted on his face and neck. ፊቱ ላይ ሙሉ abrasions አሉት. So observed while frequently scratch at those areas and complaints pruritus. So on his face and neck frequently sac ታይቶ ነበር ነው. So this all is at the emergency one. So the question is assuming his symptoms are due to his employment and he most likely works as which of the following. So እኚህ ምልክቶች ልክ ተቀጥሮ ስለሰራ ነው የሆነ ቦታ ተቀጥሮ ስለሰራ ነው ምልክቶቹ የመጡት ብለን ብናስብ ምን አይነት ሰው ሆኖ ነው ተቀጥሮ የሚሰራው ይሄ ነው ጥያቄው. So the first one is bird keeper, B diving instructor, C farmer, D fireman, E shipyard worker. ስለዚህ here is እንዴት ነው ይሄን ብሮት ዳውን የምናደርገው? So the answer is it is fireman, and this is typically a case of carbon monoxide poisoning. So that means evidence here are he has confusion of 40 minutes. He is confused, so it's acute. Okay, it's acute presentation, acute confusional state, and he has pallor, generalized pallor. So not mulu bamulu pain now. This means this is due to the carboxyhemoglobinemia. That means normally hemoglobin oxygen no meso, but it has also high affinity for carbon dioxide. So carbon dioxide has high affinity for hemoglobin as compared to oxygen. ስለዚህ እኚህ ኦክሲጅኖችን ኖክ አድርጎ ያወጣቸውና ካርበን ዳይኦክሳይድ ካርበን ሞኖክሳይድ ሆኖ ሄሞግሎቢን ላይ ሲቀመጥ carrying capacity of oxygen ስለሚቀንስ ሄሞግሎቢኑን and they will appear pale ማለት ነው. And they will be confused because the oxygen carrying capacity will be reduced to the brain. So he will be confused. And the multiple abrasions and pruritus. So multiple abrasion on the face and on the neck ያልነው አለ እና የሚያሳክከው ይሄ ደግሞ ልክ በሱ ከቃጥሎ የተረፈው ወይም ደግሞ ወደ ፊቱ ወደ ቆዳው ላይ የወደቁት የጥቀርሻው ፓርት ነው የሚሆነው due to irritant from the burn ነው የሚሆነው። ስለዚህ this patient most likely works as a fireman. ግን ሌሎቹ ለምን አሁንም ለምሳሌ bird keeper, it is the case is normally it's called cysticercosis, and he presents more of with pulmonary manifestation or more of minoro, and it takes somewhat a longer period than this acute one. Diving instructor, again, it's an acute one, so it's also called as acute decompression sickness phenomenon. So when a diving instructor, they tend to dive in the water, and so they instruct by diving into the pool. So they will have this decompression sickness. Again, these have embolism features. Again, its presentation is somewhat different. Shipyard worker, they will, while working in the shipyard, they will be exposed for the metal toxicity. And on the farmers, because it's farmer land, again, it takes a long period of time and it presents with pulmonary manifestations. So as an assignment for you, there is, again, what we call, for those who are working aerospace workers. So aerospace workers, those who work in the airway manufacturers industry, እነሱ ለምን ይጋለጣሉ? And sand blasters. Okay, sand blasters. So this will be a question in the next time, and we will address it on the next time.